अज़बिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम अर्रहमान अल्लमल कुरान खलक़ल इंसान अल्लमहुल बयान। आज काफ़ी दिनों के बाद आपसे बात हो रही है। हमेशा की तरह शुरू करने से पहले इम्पोर्टेंट बात, रिमेंबर वी कैन नॉट बी मोटिवेटेड ऑलवेज, सो वी नीड टू बी डिसिप्लिन्ड। याद रखें, एक डिसिप्लिन बनाएं, एक टाइम टेबल बनाएं और उसको फॉलो करें। आज का जो टॉपिक है वो है एकेलेसिया कार्डिया। So the patient can present with the progressive dysphagia to solids and liquids. Parents आपको कह सकते हैं कि हम बच्चा निकल नहीं सकता. There can be regurgitation of undigested food, especially at night. There must be retrosternal discomfort or pain after eating, or unintentional weight loss. There will be occasional aspiration leading to the cough or recurrent respiratory infections. Symptoms may vary in intensity and duration. In history, there will be duration and progression of dysphagia which will be worsening. There will be presence of regurgitation of aspiration episodes. There will be associated chest pain or discomfort. There will be history of weight loss, and there will be previous attempts at treatment or dietary modification without success. There can be family history of similar symptoms. So in examination, the general look, the patient may appear malnourished due to chronic dysphagia. There will be signs of dehydration or fatigue if there is significant weight loss or regurgitation is present. Vitals are usually normal but may reveal signs of dehydration such as tachycardia or hypotension in severe cases. Chest auscultation may reveal crackles if aspiration has occurred. Abdomen may be unremarkable except complication arise. So you have to evaluate for a secondary coexisting neurological disorders if secondary achalasia is suspected. So the differential diagnosis which you must rule out is gastroesophageal reflux disease, which presents with the heartburn, regurgitation, but typically lacks progressive dysphagia. Esophageal stricture can also present and is due to GERD or malignancy. Dysphagia usually more for the solids. Esophageal carcinoma, progressive dysphagia, weight loss, and possible hematemesis or melena. Diffuse esophageal spasm, intermittent dysphagia with chest pain. Chagas disease, similar to achalasia but endemic to areas like Latin America and is caused by the parasite Trypanosoma cruzi. So the investigations which are diagnostic, barium swallow which shows, which also called an esophagogram, which shows a classic bird beak narrowing at the lower esophageal sphincter. There will be dilated esophagus with poor emptying. The esophageal manometry is the gold standard test for the diagnosis. It shows absence of peristalsis in the esophageal body. There will be increased resting pressure in complete relaxation of the lower esophageal sphincter. Endoscopy is important to rule out malignancy or structural causes. It may show retained food or fluids in the esophagus. The imaging chest X-ray, widened mediastinum or air fluid levels in the esophagus in severe cases. CT or MRI will be occasionally used to exclude secondary causes like malignancy or external compression. So treatment, lifestyle modification, you have to advise a patient to take smaller frequent meals, avoid eating before lying down, and elevate the head end of the bed. So calcium channel blockers, nifedipine or nitrates to reduce lower esophageal sphincter pressure, which has a limited efficacy. Proton pump inhibitors for associated reflux symptoms. Endoscopic treatment is pneumatic dilatation, involves balloon dilatation of the lower esophageal sphincter, effective in relieving symptoms but carries a risk of perforation. Botulinum toxin injection reduces the LES pressure temporarily, and it is reserved for high-risk patients who are unsuitable for surgery. Surgical treatment is Heller myotomy, which is a laparoscopic division of the lower esophageal sphincter muscle fibers. It is often combined with fundoplication to prevent reflux. Preoral endoscopic myotomy, minimally invasive endoscopic procedure increasingly used with excellent outcomes. So the complications, you treat aspiration pneumonia with antibiotics, nutritional support if there is a malnutrition. The follow-up is periodic assessment of the symptoms resolution and nutritional status. endoscopic or radiological evaluation for recurrent symptoms. So thank you very much. This was a short description of the topic Achalasia Cardia. You can learn more with the different things, and I wish that may Allah be our helper, protector and guide. Do give me your feedback, and एक याद रखें कि ये वीडियो अपने 3 दोस्तों के साथ शेयर करें ताकि वो लोग भी ये टॉपिक सीख लें। एक सदका जारिया होगा और बाकी लोगों को भी इसका फ़ायदा पहुंचेगा। सो गुड डे और अपना ख्याल रखिए। अल्लाह हाफिज़।